Let's explain hypovolemic shock. It is a life-threatening condition caused by a significant loss of fluid or blood, which leads to poor tissue perfusion and oxygen delivery. Common causes include hemorrhage, dehydration, severe vomiting or diarrhea, burns, and fluid shifts like third spacing. As fluid volume drops, venous return to the heart decreases, lowering preload, stroke volume, and cardiac output. This reduces blood flow needed to sustain organs. In response, the body activates the sympathetic nervous system, increasing heart rate and constricting blood vessels to preserve vital organ perfusion. The raw system kicks in, retaining sodium and water, and ADH is released to reabsorb water in the kidneys. If fluid loss continues, cells switch to anaerobic metabolism, producing lactic acid, causing metabolic acidosis. This leads to cellular damage, inflammation, and can progress to organ failure and death without prompt treatment.
Blood loss. Losing a lot of blood can cause hypovolemic shock. This can happen from accidents, injury, surgery, heavy bleeding during childbirth, stomach ulcers, or internal bleeding. Also from fluid loss. You can go into shock if your body loses too much fluid. This can happen with severe vomiting, diarrhea, not drinking enough water, heavy sweating, or heat stroke, or serious burns. Some medical problems like pancreatitis or diabetes. Other risk factors can be people more likely to get hypovolemic shock is being older, having health problems like heart or kidney disease, taking medicines that cause bleeding or water loss, not getting help quickly when bleeding or sick.
Signs and symptoms for hypovolemic shock. The signs include intravascular volume has decreased by 15%. This would be done by excessive diarrhea, excessive vomiting, injury with blood loss. The symptoms would include rapid heart rate. This is due to compensatory measures to compensate for the loss. So we would again have high heart rate, SVR has increased. This is to go ahead and boost cardiac and tissue perfusion. We'd have poor skin turgor and thirst.
So some of the complications for hypovolemic shock include having fluid overload. Some patients might get a myocardial infarction, a stroke, hypothermia, abdominal compartment syndrome, acute respiratory distress, renal failure, post-traumatic disorder. When a patient suffers from hypovolemic shock, they may receive norepinephrine, epinephrine, or dopamine. With these medications, of course, one can have some complications and side effects, and that may include an increase in the blood pressure, an increase in the heart rate, difficulty breathing, headaches, or irregular heartbeat.
Nursing interventions play a central role in the early ongoing management of hypovolemic shock. Immediate actions include ensuring airway patency and administering high-flow oxygen to optimize oxygen delivery, establishing large-bore IV access for rapid fluid resuscitation with isotonic crystalloids or blood products. Vital sign monitoring is critical to assess the effectiveness of interventions and to identify signs of deterioration. Monitoring urine output via a Foley catheter is essential for evaluating kidney perfusion. Nurses must also provide neurological assessments, maintain patient warmth to prevent hypothermia, and prepare for potential transfer to intensive care. Nurses play a key role in communicating patient status to the healthcare team, supporting the patient and family, and ensuring documentation is accurate. By combining pathophysiologic understanding with timely nursing interventions, nurses can significantly reduce complications and contribute to better survival rates for patients experiencing hypovolemic shock.